Welcome back to the Lost Book of Herbal Remedies. I'm Emma, and today we're tackling one of the most complex and concerning neurodegenerative diseases, chronic traumatic encephalopathy, or CTE. It's been a major topic in sports, particularly in American football, but its impact is far-reaching, and recent research has only deepened our understanding of this debilitating condition. We'll explore everything from its causes to potential treatments and the latest insights from cutting-edge research.
That's right, Emma. CTE is primarily caused by repetitive head impacts, or RHI, which athletes experience in contact sports. This disease develops over time and is linked to the buildup of a protein called hyperphosphorylated tau in the brain. What's alarming is the broad range of cognitive, emotional, and behavioral symptoms that can result. Everything from memory loss and confusion to aggression and depression.
Yes, and while awareness of CTE has certainly grown, diagnosing the condition remains a significant challenge. Most diagnoses can only be confirmed post-mortem, which means that living individuals, especially former athletes, may struggle with perceived CTE, believing they have the disease based on their symptoms, but without definitive confirmation.
Exactly, Emma. Let's talk about perceived CTE, which is becoming a major issue among former athletes. A study from the Football Players' Health Study at Harvard revealed that around 34% of former professional football players believe they have CTE. The mental health burden this belief creates is staggering. Those who believe they have the disease are far more likely to experience anxiety, depression, and even suicidal thoughts.
It's such an important issue, Alex. Among those former players, about 25% reported experiencing suicidal thoughts, compared to only 5% of those who didn't think they had CTE. The fear of having an untreatable neurodegenerative disease is a significant psychological stressor, which makes mental health support in this group absolutely essential.
And that's not all. The clinical profile of perceived CTE shows associations with younger age, a history of concussions, and subjective cognitive difficulties. Many of these individuals also report emotional discontrol and low testosterone levels. All of this highlights the need for comprehensive mental health screenings and support systems for former athletes who might be misattributing their symptoms to CTE.
Right, Alex. But diagnosing CTE during life is still a major hurdle. As we mentioned, the only definitive way to diagnose CTE is through postmortem neuropathological exams. The symptoms overlap with other neurodegenerative disorders like Alzheimer's, which complicates things even further. And unfortunately, current diagnostic criteria are primarily useful for research purposes, not clinical practice.
That's where biomarkers come in. Researchers are exploring biomarkers that could help detect CTE earlier and more accurately. For example, tau PET scans and cerebrospinal fluid biomarkers like p-tau202 and p-tau231 are promising candidates. These markers could help distinguish CTE from other neurodegenerative diseases and give us a better understanding of its progression.
Speaking of research, let's talk about the perivascular space, or PVS. It's an emerging area of study in relation to CTE. PVS are fluid-filled spaces around the brain's blood vessels which help clear neurotoxic proteins. Recent studies found that athletes with repeated head impacts had larger PVS volumes, indicating that their brain clearance mechanisms might be impaired.
That's a fascinating connection, Emma. Larger PVS volumes have been linked to worse cognitive functioning, and this relationship suggests a potential pathway through which repeated head impacts could lead to cognitive impairment over time. It's another piece of the puzzle in understanding the long-term effects of brain trauma.
Exactly. And it also points to a dose-response relationship. More head impacts, more brain damage. Understanding this can help us develop better preventative strategies for athletes and others at risk.
That brings us to treatment options. Right now, there's no cure for CTE, but non-pharmacological interventions are being explored. Cognitive rehabilitation therapy and mood-focused psychotherapy can help manage some of the mental health challenges. Mindfulness-based interventions have also shown promise in reducing anxiety and depression linked to perceived CTE.
And lifestyle changes are another crucial component. Regular physical activity and following a Mediterranean diet, which is rich in antioxidants and anti-inflammatory foods, could have neuroprotective effects. Research is still ongoing, but these interventions may help reduce oxidative stress and improve cognitive function.
When it comes to pharmacological treatments, the focus is on managing symptoms rather than altering the disease itself. Medications initially developed for Alzheimer's, like cholinesterase inhibitors, are being used to help with cognitive symptoms. And antidepressants, particularly SSRIs, are commonly prescribed to manage the mood disorders often associated with perceived CTE.
Yes, and let's not forget about the potential of nutraceuticals and antioxidants. Compounds like N-acetylcysteine, NAC, resveratrol, and omega-3 fatty acids are showing promise in preclinical models for reducing inflammation and oxidative stress, which are both key contributors to CTE.
And research into investigational therapies is gaining momentum. Immunotherapy targeting tau protein is being developed, with monoclonal antibodies showing potential to reduce tau accumulation. This could pave the way for more targeted treatments in the future.
There's certainly a lot to be hopeful for in terms of treatment advancements, but the key to combating CTE will be early diagnosis. Continued biomarker research, along with improved neuroimaging techniques, could eventually allow us to diagnose CTE during life, which would open the door to earlier intervention and better outcomes.
Education and awareness are also vital. Athletes, coaches, and healthcare providers need to be fully informed about the risks of repetitive head impacts. The sooner we can recognize symptoms and intervene, the better we can support those at risk.
Public awareness campaigns are crucial too, especially to destigmatize mental health issues related to perceived CTE. Encouraging former athletes to seek help without fear of judgment can have a significant impact on their quality of life.
Exactly, Emma. And support systems for former athletes are just as important. Peer support groups and access to mental health resources can go a long way in addressing the psychological impact of perceived CTE. Feeling isolated can make the mental health burden even worse, so creating a strong community is essential.
That's why it's so important for healthcare providers to understand the unique challenges that former athletes face. By addressing both the physical and mental aspects of their health, we can ensure they receive the comprehensive care they need.
And of course, for those who prefer a more natural approach, there are herbal remedies that can support brain health and cognitive function. In the Lost Book of Herbal Remedies, we outline several herbs that target neuroinflammation, oxidative stress, and cognitive decline, all of which are critical factors in CTE.
Exactly. One of the best herbs for this is curcumin, known for its anti-inflammatory and antioxidant properties. It's been shown to reduce tau protein aggregation, much like what we see in CTE pathology. There's also Bacopa monnieri, which enhances cognitive functions and offers neuroprotection.
And don't forget about omega-3 fatty acids from algal oil. Omega-3s support brain cell membranes and reduce inflammation, making them great for cognitive health. Ginkgo biloba is another key herb, as it improves blood flow to the brain and protects neurons from damage.
I also want to mention lion's mane mushroom, which promotes nerve growth and regeneration. And for those dealing with anxiety and sleep disturbances, valerian root and passion flower are excellent herbs to include. They can help with emotional regulation and improve sleep quality, which is often a challenge for those with CTE.
It's great to see that we can combine these herbal remedies with conventional treatments to offer a holistic approach to managing CTE symptoms. But as always, we recommend consulting with a healthcare provider before starting any new regimen.
Absolutely. So to wrap up, chronic traumatic encephalopathy is a complex and challenging condition. But with advancements in research and a focus on both mental and physical health, we're making progress. Whether through early diagnosis, therapeutic interventions, or lifestyle changes, there's hope for those affected by CTE.
If you'd like to read more about the latest research into CTE or explore the herbal remedies we've discussed, head over to herbalbloom.org for the full article.
Thank you for joining us on this episode of the Lost Book of Herbal Remedies. Remember, your health is within your control. Stay informed, stay healthy, and we'll see you next time.